The coronavirus pandemic is affecting people in different ways, especially those with pre-existing conditions. One of the pre-existing conditions that is often overlooked is Duchenne muscular dystrophy. Duchenne muscular dystrophy is an X-linked recessive disease that is characterized by progressive muscle weakness and degeneration, including cardiac and respiratory muscles. As you know, a common feature of muscular dystrophy is respiratory failure due to recurrent aspiration and increase in resistance, which is often very fatal for DMD patients. COVID-19 will accelerate respiratory failure by causing poorer airway clearance and the need for long-term ventilatory support. Before the coronavirus pandemic, patients with Duchenne muscular dystrophy are treated with corticosteroids and angiotensin-converting enzyme inhibitors to help with cardiomyopathy. However, there have been some concerns surrounding the use of angiotensin-converting enzyme inhibitors or angiotensin receptor blockers, as they are co-receptors for the novel coronavirus, and as such could be fatal if patients come in contact with coronavirus. For now, physicians advise that each muscular dystrophy patient continues their treatment with corticosteroids and angiotensin receptor blockers, but with care and constant evaluation.
Healthcare workers and providers have had to adjust and implement non-traditional practices in order to limit the spread of COVID, as well as to limit endangering lives of patients that may be susceptible to getting the virus. Implementation of telerehabilitation programs as well as telehealth has been centered around investigating the needs of DMD patients, establishing online rehabilitation programs and motor assessment for ambulant and non-ambulant DMD patients. They can be safely performed in the time of limited access to institutional rehabilitation services. Some of the regimens provided in the telerehabilitation programs include rehabilitation services that DMD patients prefer, online workshops, videos of exercises and instructions, as well as individual online consultations.
And of course, we cannot talk about the coronavirus pandemic without mentioning the harmful effects it has caused to mental health crisis and substance abuse. In December 2020, 42% of people surveyed admitted to feeling symptoms of anxieties, which is an 11% increase from the year before. The increase of mental health crisis has undoubtedly affected patients with Duchenne muscular dystrophy as well. In a recently published Journal of Developmental and Behavioral Pediatrics, researchers found that 45% of older males with DMD are diagnosed with at least one of the three following mental health disorders: depression, ADHD, and behavioral concerns. Not only that, but the use of steroids were also shown to negatively correlate with the mental health state. Males ages 1 to 29 years of age with DMD who use steroids are twice more likely to have behavioral concerns. As a result, people have been coming up with new ways to improve mental health in DMD patients over the course of the pandemic. For example, patients who are in the United Kingdom have been holding an online psychological support workshop in order to share learning and experience. In addition to that, disability resource groups have been remotely connecting patients with DMD together so that patients can share their emotions and know that they are not going to be alone through the pandemic, and they are going to recover together.